2022 marks the 66th anniversary of the Women's March to the Union Buildings to petition against the past laws of the country at the time. This August, we join millions of South Africans in paying tribute to the courageous women of 1956, to whom we owe our freedoms we enjoy today. A very warm welcome to this fifth installation of the E-Lounge. Today, we are very honored to be joined by a doctor, a keynote speaker, mental health advocate and founder of Sisters for Mental Health and Chief Executive Officer of Vocal Mentality, Dr Samke Ngcobo. Dr Ngcobo is a qualified medical doctor, passionate about mental health advocacy and mental health psychoeducation. Our conversation with Dr Ngcobo is about her book titled Reflections of a Convoluted Mind, A Journey with My Mental Health Illness. The book is inspired by a desire to create an awareness and understanding about the life of someone who is living with a mental illness. As someone who's been living with bipolar disorder since the age of 14 years old, Dr. Ngcobo shares a valuable insights of a journey as a doctor to individuals like herself. The intention is to humanize this journey through sharing her insights and inspirations. Insights and inspirations stimulate great conversation. The E-Lounge is one of our knowledge share platforms anchored on our values of learning and leadership. We do hope that you tune in, engage, and take away the knowledge from this great conversation. And always remember, those who desire to lead should read. Thank you.
When Brené Brown says courage starts when we let ourselves show up and be seen, she's not only simply asking for us to show up, but she's asking us to be seen. Now, my guest today has not only gone past the being seen. My guest today has had the courage to be able to talk about a subject that in most cultures everybody shuns. In most areas, if you speak about it as a professional, then everybody looks the other way. But she's not speaking about it from a third person. She is not living vicariously. She is actually speaking about her own life and what she's had to go through to be able to manage certain things. Today, we speak about that not only from a perspective of what it means to everybody else, but we speak about it because of the courage of women, the mothers of our land, the sisters that we have, and everybody else who fought for our freedom. And, pay respects to those that have been and that will always be. Dr. Samke Ngcobo, welcome.
Thank you so much. Thank you very much.
You've already been introduced in a very illustrious manner, but me, I want to get to know the time before we go to the doctor part. And we still, talking about Samke. Who is Dr. Samke Ngcobo?
Dr. Samke Ngcobo is a young lady who is passionate about issues related to mental health and mental illnesses. But that's not my primary identity. I always say that that's a part of my journey. There's so much more to me than that, because oftentimes living with a mental illness or having any diagnosis becomes your identity. And I'm somebody who has wanted to portray a level of authenticity and honesty regarding my life, and to show that you can thrive and live a very full life despite that. So before there's the doctor title, before there's the mental advocacy title, I'm somebody who lives a life of authenticity and truth, a life that has its own struggles, but most importantly, a life that is filled with love and joy, but also has struggles which I acknowledge.
Your struggles are not the simple ones. And to start at 14 and go through that right up until now, at some point in the book, as I was reading through it, I'm going, okay, she eventually became a doctor. Now, this is a story worth telling. Walk us through that, the first diagnosis, and then, the challenges that came through it.
It's been a bumpy ride, very colorful. 21 years of ups and downs, severe ups, severe downs, because also of the nature of the illness. So at the age of 14 years old, I was displaying behavior that was just not normal, as people would describe. There are just many highlights of that journey that I recall, even in my still young age of 35. But 14 years old, my parents would observe things that I was doing and saying that didn't make sense, speaking with people who weren't there anymore, saying I could hear them, communicating, sending messages to them. And that became increasingly concerning. So it wasn't just seeing abnormal mood, because a 14-year-old, they're assumed to be temperamental, they're assumed to be unpredictable. But what was glaring at my parents was the fact that I felt like people were listening to my thoughts. I was listening to the radio and I felt that people were talking about me directly, and I think that became a worry for them. So it took a lot of change of events and abnormalities and concerns for them to end up acting and taking me to my first mental health care services at that age. And it's been quite a ride. I was in grade 9 at the time in a place where mental illness was not spoken about as it is now. Right now, we sort of know many other people who speak about their journey, but at that time, there was no openness about it. So I've gone through a number of exorcisms along the way. I have been deemed to be somebody who is bewitched or, feared because of that. So a lot of stigma came to it. I think the biggest level of stigma came through to myself. That was the biggest one, because there was a lot of shame associated with it. So I certainly did not plan that at this point in my life I'd be speaking so vocally. That was not part of the life plan at all. And as you managed that and mentioned that, the journey itself was not smooth at all. Medical school was not, I did not have a normal university life because of the fact that I was becoming ill so often. I think the pressures of life at the time and the demands and just life demands at the time changed the trajectory of how I was navigating. So high school, I became ill at that point at age 14. After that, I call it the sleeping giant. It became quieter. Matric, to get into medical school, I had done very well. With the bursary, first 3 years, smooth, lovely. And then things took a turn where I'd be admitted twice a year at a time, once a year at a time. And, I felt different to everybody else because I had the struggle that many people did not understand.
But in that, Samke, you found power. And you found your story.
Yes.
And it's that story that I'd really, really love for us to tell. Because before you became an advocate,
yes,
there's many, humps in this bumpy ride that you'd had to go through. I mean, for instance, when you hit a bad patch and you ended up in a public mental institution, and that is it's even in reading it without experiencing it, it's a harrowing story in itself. But there's all these ups and downs.
Yes.
But you just seem to always bounce back.
People say that, and I'm so humbled by that. And I've never looked at it that way, that after all that happens, somehow I just always emerge, and I'm grateful for that resilience. Even the experience that you talk about, it was actually fairly recent. It was 2 years ago. And ending up in a mental health care facility that was a public one was my first time. So I've always enjoyed the luxury of private health care and all it came with. So due to an unfortunate series of events, I found myself there. And I think that's when the advocate, the mental health advocate, the mental health activist was birthed, because I was just so oblivious to some extent. Yes, I've worked in mental health care services, and I knew of things that I was wanting to avoid, for example, related to what had happened in the public space, with life as Sitimeni. But it was not in front of me to know the experience of what is it like being behind those gates and having securities, being around so that your family comes to see you. So for me, it was a complete paradigm shift, for which I'm grateful for looking back. But at the time, I was so devastated. So the wonderful thing is I took those lessons from that experience and I said, I'm going to be that person where I felt a responsibility to speak of my journey. I felt a responsibility as a medical doctor to use my life as a testimony, to use my life to say, a mentally ill person is not just the diagnosis. There's so much more to me. I'm a medical doctor. I'm a good friend. I am a family member to people. I'm a friend to many people. And, just so that I'm not defined by the illness, yes, it's a story that many people are blown away by. And I'm also quite blown away that I'm still standing. but for people to see that my identity is not the illness only, you can thrive despite that. And I felt that many a time we look at the surface of this journey, you know, and there's so many stereotypes, so much prejudice, so much negativity, and of how a mentally ill person is portrayed. And I just thought, I'm living with this. Here I am, and I will take charge of my narrative. And that's the biggest thing. I wanted to take charge of the narrative and not wait for the next person to sort of talk about it.
Taking charge of the narrative didn't just come easily.
Absolutely.
Because you speak quite broadly about the issue of stigma. And I want to roll back to the initial diagnosis.
Yes.
And, you know, church people coming to pray for you and not wanting to have anything to eat at your house. I mean, that's a harrowing story. That it broke my heart at some point in time when I was reading through it, and I thought that is not really the way we should be treating people. But tell us a little bit more about that.
So, you know, in my initial diagnosis, I mean, this is 2001.
Okay.
And people, they didn't understand. So bless their hearts as well. I don't hold any resentment now. But, you know, I recall a time whilst in hospital where people came to pray for me. So I could just see that, you know, one thing that was lacking was compassion. It looked like I had done something wrong. And I think that's what stands out for me. So it's only in hindsight that I realized that I was being exorcised, because I'm being made to shout the name of God. So I have to say, Jesus, okay, cool. Then I have to say that again, and they're becoming louder. So I'm just seeing the big people telling me to repeat what they were saying. So when they became louder, I became louder, complying with what they were doing. It's only in hindsight that now the whole ward is in a standstill, because, you know, there's these people around me, I'm being made to shout this. And then I think they felt that the louder it became, they were casting something out of me. And then there was that level of avoidance towards me, because people felt that what I had was contagious to them. And I was made to feel guilty and described to be the weakest link to have allowed this thing to happen to me. So there was a lot of conflict between me and God for a while, because I thought, how does he select people who can house demons? I had not done anything wrong. I had come from a very religious family that, you know, that was prayerful and very committed to this journey. So how was it selected that I'm that person? What was I doing wrong? So there's a lot of confusion and a lot of resentment, and I felt isolated in that journey. So the other thing, people who are very deep in the sense of tradition and cultural beliefs felt that, you know, I was bewitched. Oh no, she's too intelligent. That's why this has happened to her. People have bewitched her. So for me, it's now become a lesson and to educate people as well, you know, to say that not everything's not to dismiss the religious beliefs, it's not to dismiss the cultural beliefs, but to also realize that there is that element where interventions can happen and you live a better quality of life.
On a broader sense of it, taking that power that you've now created in telling the story, because I can see a young man, a young lady somewhere out in the location. I mean, your circumstances could have been replicated in any location, be it in KZN, in Gautrain, everywhere else, the behavior would be the same. Now, how do we start to be able to tell the story differently? And that's what bothered me quite a lot as I read. So I tend to reflect in order to create insights out of what I'm going through and reading and all of that. And the question I had is like, but how do we start to tell the story differently so that people get educated?
You know, I like that question because my common thing is, I believe that, I say it often, and people have heard me say it often, that the best storyteller about mental health issues is the person living with it. Because people, at times, it becomes too academic where people speak at us.
Yes.
And at times, people who live with mental illness, and understandably, are clouded by shame.
Yes.
So when we take charge, and I believe that I'm in a space of living with it, and I'm also a medical professional, I decided to take charge in that sense. So I believe that if we take charge as people living with mental illness, that is how basically it becomes something that is less stigmatized. And because I've experienced all of that, I feel that, you know, being the person who speaks about it is the way to go.
It is a big step, but it's a step that I think you would have had to as some people say, workshop yourself around it, because just simply think through what this means, the status of being a doctor, and a doctor in a space where you'll have to advise people in this. I mean, what were the iterations that you would have to go through with all of this? And that leads nicely to people who are asking, well, do I declare my mental health issues at work? And how are people going to take me? But let's go through the workshopping, and then but also the stigma that went with it later on, and some of these doctors telling you that people are discussing this thing.
Yes, I had been pushed to a point where, it was a risk to say I'm a medical professional who lives with a mental illness, because there can be that level of being seen as inferior to my peers. Can I be trusted? Because other people may be open-minded to say, wow, this person has come forward, but others may be fearful of that. And for me, I just felt that, the word is workshopping myself, because I didn't wake up to just speaking. I think I was pushed to such a corner that I felt a responsibility. As I speak about the time when I was in that mental health facility that was a public one, I knew, it felt like forever being there. But after leaving, I felt that I'd be leaving other people behind, back to my own comforts, of life. It took a lot of reckoning, because I'd been booked in an incapacity leave for 6 months. And I think that time was the time of the workshop, where the 6 months where I had to see my identity without the title of being a doctor. What if I don't get back to this? Who am I? And hence Reflections of a Convoluted Mind was born, because I was reckoning with, what does it mean for me to live with a mental illness? Yes, I've walked this journey for 21 years, and I think the acceptance came only 16 years later. But then, what does it really mean to live with a mental illness? Because there was an element of a denial for a very long time. Yes, intellectually, I acknowledged that I have this, but I thought I'm the different one with bipolar. I'm different, I'm the one that will live without the medication, no need for assistance. Until I had to sit down and realize how much it was costing me, socially, emotionally, reputationally. And that was the turning point. So there's a lot of reflections, lots of interrogations, soul searching, and, being acquainted with the fact that, wow, people no longer see Samke, people no longer see the professional after that major public relapse. And for me, I told myself during that time that I will not let my illness define me. And also, I knew that I had to take charge of my narrative. One of the biggest things during that time was getting to a point where I said, I can't escape myself. I can't undo the things that have happened. While I'm on planet Earth, I can't speak about the afterlife. While I'm on planet Earth, I can't be Samke. I can't be anyone else but Samke. So it's either I choose a life of being incognito for the rest of my life, out of the shame that it had brought me, or I just take charge of it and dispel all the shame, confront the stigma. And that's basically what it was for me. The workshopping was quite a panel beating, if I may say so myself.
that I'll take with me. It's a panel beating, it's no more workshopping. Now, to a great degree, then the Reflections of a Convoluted Mind, which is the book we're discussing today, then was born from all of that, from you sitting down, reflecting on all of this. And I want to talk about that, because in there lies a very, very pertinent story. People being able to find their own voice through adversity. And in your sense of, what do they call it, you've had time to look at these things and saying, but what drives you? What drives you beyond telling, being the voice for the voiceless? What drives you?
What drives me, I've never been asked in that way. What drives me is a passion to take charge of my own story. I did not want to be somebody that is seen according to other people's. People can have a perception of me.
Yes.
I can't control that. But I wanted how I show up in any space be something that comes from me and is truthful to me. The only way that could have happened is if I determine what I want to say, determine that voice. And I think what drives me is I'm driven by, the love of my family. I'm driven by my own understanding of who God is, and that, I live as a child of God who loves me, and I am loved and I'm able to love. Because when everything was taken away from me or threatened, that is all that kept me grounded. So I come from a very loving, cared for background, and I think that's been my driver, basically, that has inspired me to keep climbing to new heights every time.
So, the dance between Samke, the professional, Samke, the activist, and Samke, the person living with the illness, it's one I wouldn't say, you say it time and again. It's not that you've mastered it, but from us standing outside and looking in, it's like almost want to ask, how do we share this force that lies in you? I remember an old friend of mine, he said their confidence is so intriguing that it must be bottled and be sold. Like, how do we sell some kids resilience and give it out? But let's talk about this dance, the three spheres, and how you've meshed them, because you've actually managed to mesh them into one. And therefore, you're no more caught up between being Samke the professional, Samke the activist, and Samke the person living with the illness.
So as you read that, I call it the dichotomy.
Yes.
I sit on the patient's seat, and I also have been sitting in a place where I'm seeing people like me. I think one of the two things is, one of the biggest things for me has been having the boundaries to know, I'm one person, but I know when I'm in that space of activism and advocacy. I know where I am when I'm in my place of work as well. But also, I'm very clear on who I am as Samke, just Samke. Same is my nickname. So I know that when I'm not doing the work that I do, because it feeds itself. When I'm Same or Samke at home with my friends, they don't see activist, they don't see doctor, they just see a friend, a sister, a daughter. And that's very helpful then to how I show up in the world. So I'm very clear about how I am in those spaces. So you call it the dance, and it definitely is that, because right now as I sit, I bring all those people with me. I bring Samke, the doctor. You can't separate that. You can't separate it who I am. I'm somebody who lives with this every day. So it's not like I take a break and I say, okay, bipolar, stay in your shelf. It comes with me all the time. I think having a clear boundary between all those roles where it matters. And I think the other thing is to realize that I'm all those things in one. So bottling, packaging packaging it is that I think one of the biggest things is I've made sure that I'm truthful in my story, that I will come with my hair combed to interviews, I will come presentable, but I have to say that there's nothing glamorous about this journey. And people always say that I look like I've coined it, like I've mastered it, to a point where they can struggle to believe that this is actually my truth. I think being honest about my vulnerabilities, being honest with the behind-the-scenes struggle is something that makes people connect well with me. I think people see the authenticity of my story and the fact that I've really touched on very deeply, even in how I narrate my story, that this is the darkness, but also, most importantly, they can be light.
You saying, I'm a doctor who has a doctor, and that is an important story to be able to articulate in the sense that a lot of professionals tend to not want to tell their story because, how am I going to be perceived? And if you were to, maybe probably in one or two sentences, if you can, but if it has to be a big paragraph, it is what it is. How would you share with somebody that says, look, I'm a professional, I've been living with this thing, I am taking treatment for it, but I have never ever been courageous enough to be able to share it?
I think it's very important to identify our safe spaces. You mentioned it even earlier. How do you show up in your workplace? Do you just declare? And to whom do you declare it to? I think it's very important to know who you're sharing your story with, because it can backfire quite badly if it's given to the wrong hands, given to the wrong ear. So I think, as I say, I'm a doctor who has a doctor. I think oftentimes doctors are seen to be invincible. People will often joke, how can a doctor have the flu, as if we've got a cure for everything? And it's not the case. We're very human. In the places of work, we show up with, our knowledge and skill and care for our patients. But we are humans, not at the end of the day. We are humans daily, not at the end of the day. We have to show up with what we've qualified for and bring the skill to that space. But I think one of the biggest things was to, in my speaking up, was to normalize the conversation that as doctors as well, we have our own struggles, to humanize the journey, because at times there's so much pressure for us to just always be at our best. And I want to, there are many doctors who struggle with mental health issues, and many have reached out to me as well, saying that, how do I get that courage to speak? And I think us having a community that is saying, you know what, I also am struggling with this, but here I am, despite all of the odds that may be stacked up against you, you are showing up and doing what you need to do. And, to befriend the medication is not an easy task. It's not, it's a love-hate relationship, and I think it's an ongoing one. But I think the biggest thing about it is to own it. Be kind to yourself. I think there's social stigma, there's religious stigma, there's cultural stigma. But I think the biggest stigma to overcome is self-stigma, because essentially, it won't go away overnight, that is. We pray and hope that those kinds of stigmas will go away. But I think when you overcome the self-stigma, the rest ceases to matter. And I think that's the one I can say bravely that I've overcome. Because I wouldn't be able to sit here and speak publicly. So other stigmas I can't change, but the self-stigma makes me come out and be, the self-stigma that I've overcome then has enabled me to stand forward. And I think I'd encourage fellow professionals in any space, actually, to overcome the self-stigma, to process the pain that it comes with, to see how much has been lost, but also see how much can still be gained through this journey.
Now, let's delayer the stigma, because sometimes we take it for granted as ultimately it ends up being self-stigma.
Yes.
But it starts from the layers that come from outside. And I want us to talk about that, because it is us being able to, it's people reflecting on their own behavior. And that's much more important to me, because as a community, we stigmatize the people. And then, then you get closer to, your church, and then that's another level of stigma. And then ultimately you get down to the neighbors there. But then you had one powerful thing that said there, your family was always there for you. And let's talk about the importance of, what do they call it, of family and in this space, because that's the first bit that will help with relieving the self-stigma.
Absolutely. I completely agree with you, because we can speak at the rooftops to the community, but if you don't have the support structure, so as you're saying, there's so many layers to it. And starting from within, the core, I call it my core, that has been critical, because had it not been for the love and support primarily of my parents first and foremost, and then of other family members and friends as well, I would not have the ability to speak in bigger spaces. But because I am embraced and understood at the level of family, then I'm able to speak in other spaces. And it's crucial in walking this journey, because it can be a very lonely journey, because I could be speaking in a public space and then come back to a whole level of rejection. So for me, those people are paramount to my well-being. And I think oftentimes we take that for granted as if it's a given, but they have been very important in my well-being, because they're able to see when I'm taking when I'm deviating from my norm. Earlier on, before I end up in hospital, they'll say, you're not 100% fine here. When even before I have the insight, so then I'm able to see, or I'll be able to examine my reaction and think, this was a bit disproportionate to the matter at hand. So taking their feedback and responses has been very helpful to me. And then you build it then to community. You can't persuade everybody, but taking it one person at a time, one perspective at a time is what will achieve us to just normalize this conversation.
Some people don't have the immediate family support, because when these things happen, it's everybody shies away. And we have to speak openly about these things. The more affluent you are and the more recognizable you are, but do as Slaza, kind of a thing. And that is an important conversation that we need to have openly as a society, that family support for somebody who is going through a lot of things is a very important bit, because if you don't have that, I always say to people, I'm not afraid of a lot of people, but I'm afraid of somebody who thinks Gizoekai. Then you know that person doesn't cares very little about you, because they can walk back home. They can lose everything they have, and they will go back and they'll be accepted as they are. And that's an important conversation for us to have, to be able to say, families need to be able to put a lot into this journey. And you've just said, look, you know, from your end, your family being there has been one of your greatest, you know, pleasures, and the ability to be able to speak about it. Now, similarly, I think the family and their outlook, in the sense that how they react to somebody speaking about you out there. How much has your family had to defend you in a great way? Or not even defend you? I mean, a mother's love knows no bounds.
No, definitely. You know, one of the biggest things is that my family has not obsessed so much about how we are perceived. They've really centered me in what goes on in our world.
Yes.
Because we can't control how people react to us. But I think because I have that grounding of the people around us focusing on the journey, focusing on me, and I think because they have not focused essentially on what's happening outside, that has been centering and anchoring. And you're correct in saying that not everybody has that. And it's an important thing to highlight, because we may speak about, you know, I can speak about how wonderful my family is, but not everybody has that support structure for many reasons. Maybe the family doesn't understand the illness. Maybe the family is frustrated with somebody who refuses to take their medication, refuses to you know, to embrace the support that is available. Then you find that people start giving up on you. So, you know, there's many factors at play, and I think it's important to acknowledge that not everybody has the same level of support, same level of understanding. It can be very frustrating for families as well. So for me, my parents, my family I think one of the biggest things is they've continued to see me as Samke.
Okay.
They've continued to see me as I'm, through whatever they've witnessed in me being unwell, and through seeing me at my best. They've never shifted how they perceive me, and that's been very important to me. And I think having that understanding from them, and them not worrying about what are people saying behind our backs, what are people, you know, that kind of obsession with what's happening outside and around us, that's been my anchor.
Talking about that, in relapses, in the many times when these things happen, there's an aftermath. You know, when Storm Samke goes through, there is a consequence to a lot of things. And I think I want to talk about it in and around the issue of treatment. Because, you know, people in certain cases are afraid to be seen, to be taking the treatment, and so therefore they don't take it as regularly as it should be. And then on the other end, and it all goes back to the issue of stigma. Let's talk about the issues of, you know, how many times, you know, when Hurricane Samke had gone through.
Hurricane Madam J.
Yes.
You know, I think I had to dig deep in writing those chapters and writing those aspects of my illness.
Yes.
That the tsunami comes and strikes, and it's awesome at the time. There's the high, there's an excitement, and then there is an aftermath. And it's important to realize that, you know, it's a very costly thing.
Yes.
It's costly financially. It's costly in terms of reputation. It's costly in terms of time, because you're in hospital, from hospital, you're recuperating from being in hospital. That can be weeks and months, depending on how severe the relapse was. And I think one of the biggest things for me has been, that has pushed me to you know, remain on a good path, is I just became exhausted. Okay. It's been 21 years. Too many ups and downs, too many admissions to hospital. I can count beyond my hand how many times I've landed up in hospital. It's hard to believe it because I'm well put together today, but it becomes a very chaotic time. Difficult for my loved ones, difficult for me, and frustrating also. I get frustrated with myself, they get frustrated by the situation, that you can do better, you can be better. Why are you continuously being in that space? And then you mentioned the topic of medication. Medication is a very important part of this journey. It's a topic that people are very uncomfortable about, because there's people who still live this journey but don't want to face the fact that this needs medication. that has been one of my biggest challenges in walking this path, because it's a schlep. You know, every single day, twice a day, there's this journey. And, you know, I speak about that, my relationship with my treatment, that it's a love-hate relationship, but one where I know that the medication is still waiting for me to take it. And I know that no matter how much I deviate from it, it's still waiting for me. So it's like escaping something that's always there, and you know, I can't shake that. I've tried too many times to avoid it, but at the end of the day, I found myself needing it nonetheless. And I think there's such a stigma to saying, you know, because of what people say, you know, for lack of, you know, in vernacular, to say uyahlanya.
Yes.
There's so much that, so you're saying that I need tablets every day.
Mm-hmm.
Does it mean that why is my brain functioning differently to other people?
Yes.
Why do I need so many interventions to help me remain well? And I think that's what makes me set apart then. And anyone who lives with a mental illness, so much goes into maintaining your sanity. And that's a very difficult pill to swallow.
Now, you say sanity is important, but we tend to take it for granted. I guess somebody who's living with, or who does not live with a chemical imbalance, to them it's part of life until the day when something happens and suddenly you're in that space. And it's a reality that can happen to anybody. I mean, I've seen people, you know, that for years you wouldn't, maybe it was there or it was just laid dormant as you call it. But I like Madam J. She spends money, and I like anybody who spends money.
Yeah, no, Madam J is a character, and it's helped me make sense out of myself, because, you know, she's that daredevil, and she says things, and I've taken a bit of her. I think a part of her is with me, because I'm actually quite a mellow, quiet person who minds their own business, but to be able to get into the spaces I've been, and I think there's a bit of Madam J that I carry with me.
That you carry with you,
yes, and I think, you know, that thing of saying that sanity is something we take for granted.
Yes.
It's like, you know, it's like having hands. You're not going to think of what it's like to not have hands because you've had the luxury of having hands. And I think it's that sense of, until you're in a space where your mind is your enemy, you're not going to understand the cost of remaining well, remaining stable, until that is not there. And I think for me, I don't take my sanity for granted. The fact that I'm sitting here, able to engage, able to talk, because I know that when I'm not well, and you're not in control of what's happening around you when you're not well. So because I've been in a space of what people may describe as insanity, because I know what that's like and the aftermath that it comes with, I don't take my sanity for granted.
Going back to the issue of medication, you know, beyond being a medical doctor and just going through your writing, the reflection is you're a very bright person and all of that. And I know, and I know people who I know who are like that. Our mind is one of those tools that you don't want it dulled by anything. The challenge of taking the medication and then going through that first phase of it where, you know, it just, you know, dulls you down a little bit. It's a big issue that a lot of people are dealing with. And you reflect on it, on the fact that, you know, the dance between me being not okay at all and me taking the medication, and then it, you know, leading me to where I have to like take a few breaths where I sit down and not do anything at that point in time. Because I'll be honest with you, my mind is one of those things that I treasure. The ability to think quite quickly about anything that anybody, and a lot of people probably are struggling with that. What has been the easiest way of you being able to say, well, and you speak about it in the book, is that I have this option or that option, either not being well or taking the medication. But it's been quite a journey for you to get through that.
It's been a 16-year-long journey to finally make peace with it. And as I said earlier, that I had intellectualized very early on that I have a mental illness. But to actually befriend it, to actually embrace it and say, this is my life story and this is what it comes with. I think you say, what has made it easy? Nothing has been easy about it. It's an ongoing journey. It's not an easy journey. But I think the biggest thing about it is, you know, dealing with the side effects and having a team that listens to me has been very important. There's some treatment where I'd struggled academically during my medical school. time, because it was dulling my brain. That was the side effect. And I think people feel like it dulls the creativity, because when you're in Madam J mode, you are the most creative person out there. And then you feel like the medication just adds a boring element to it. So I think one of the biggest things is, you know, realizing that there's the side effects, and then also there's a certain state of excitement that is also toxic. And I talk about those toxic highs, you know. So it's realizing what the medication is for, how to take it appropriately, which one works for me, which one doesn't work for me, and not determined by me, but by my healthcare provider. So taking medication has been one of the biggest things related to my illness that I've had to reckon with. And, you know, dealing with the side effects has been difficult. Gaining 30 kilograms in a space of 4 months was not easy as a young person, and people judging that. So it's quite a contentious topic. Other people don't want to face it. They may acknowledge their illness. They may have alternative means of remaining well. But this is a reality that can't be ignored.
For me, a lot of what I extracted out of the book, or the synthesis that came with the book, was that education is important. And you setting up, you know, Sisters for Mental Health and Vocal Mentality has been a big journey of yours.
Yes.
And first and foremost, let's start here, because I think a lot of our viewers out there, and also the people online, are sitting there and going, but my HR does not understand this. As the people who I would have to, you know, legally go and declare to. If we have a health and safety professional in the office, they wouldn't know what to do if something happened to me. How do we start, you know, through the little bit, either be it with Sisters for Mental Health and all of that, start to educate companies? And how do companies start to educate themselves?
You know, I think one of the biggest things, and that's the aspect of vocal mentality, because we're speaking of organizations, I think one of the biggest things is this: there's such a stigma related to, even if there's a wellness program, to reach out to that wellness program. So I think having wellness programs is quite important, so that there's a culture of embracing wellness, speaking about mental illness before there's crisis mode. So to just normalize the fact that there's resources, there's, be it talks, psychoeducational talks, be it, you know, people being aware of employee assistance programs. Other people don't even know that their companies have those facilities or that as a resource. And that sense of realizing that in our work environments, we show up and have to deliver whatever work environment it is. There's the output that is needed, but to not separate the person from what is expected from them in their workplace, meaning that if you come to work, you still are a family member. You come with your problems to work. You don't separate them in terms of just the stress levels that you carry. You come with that. And for people to be able to perform well in their work setting, they need to also have their mental health embraced. So I think that aloofness needs to go away. The aloofness of people, not just in senior management, but, you know, that union of the HR people to empower the employees about what are their rights. If you need a 21-day admission, as you would as a mental health care user, it's unlike any other admission, because if you break your leg, people will send you cards, get well soon. If you can't walk for that period of 2 months, people can understand that. But you say you've got a mental illness and you're smiling like this, saying, I'm depressed. Firstly, it's how a mentally ill person is portrayed and perceived to be. And if you're booked off work for 21 days, showing a smile on your face, they think you're on holiday or something. So I think having seniors who are proactive, I think companies need to be more proactive about mental health and mental wellness, just well-being holistically, because that is how employees will feel safer to disclose, knowing that the people who are senior to them or are in the HR spaces are taking that aspect seriously.
Then we go beyond that, you know, in terms of the policy framework. We straddle the space where, you know, if you put it too directly into what they call it, into our policies and even our leave policy and most of our things, does that make it overtly out there that this is what has happened to this person? But let's talk about confidentiality, because that's where it's much more important for us to have the conversation. Because when somebody declares or, you know, says, look, I have to be booked out for 21 days, And you've had some horrible experiences with that, yes.
Yeah, I definitely have had. I think respecting the I think knowing that you don't have to declare if you don't want to.
Yes.
It may be helpful to first read your environment, because it can work against you if people don't understand. And you say that I've had horrible experiences. Mm-hmm. Indeed, I have. I recall a time when I was still in hospital. I think I was going to be there for 3 weeks. Yes. On week 2, obviously, we usually are allocated a certain number of patients. And time was passing by and I was not returning to work. All the necessary documents were being sent and the necessary communications were being sent. Mm. But I didn't have to declare to my peers why I was there. So I think because 1 minute I was there, the next I was not, there was no sign that I'm not well in any way. And I remember getting a message saying, "Hi Samke, how are you?" And I'm well, thanks. So I'm just thinking it's a normal call just to check how I'm doing. But the biggest thing was, we are taking your load. Because you're not here. I think I could sense the resentment. And then the question was, when are you coming back? Should we book you to be on call earlier in the month or later? Because we're trying to do this roster, when are you coming back? And that stood out for me. And I've never forgotten that, not out of resentment or grudging, but just to see the lack of empathy that it comes with mental health issues. Because I didn't have to declare to anybody else other than my seniors to say that I've got this issue, all the documents have been sent where they need to be, but it doesn't mean that I need to declare it to people who don't need to know about it. But then it becomes difficult for people to understand, why you're not here for 21 days. Are you on holiday? Why have you suddenly disappeared? And I think confidentiality is something that's very important, especially with mental health issues, because there's still such a stigma. People should not feel compelled to disclose, but definitely identifying safe spaces is helpful, so that when things like that happen, at least there's a context or a level of understanding that exists.
I'm intrigued by that, and without comparing it, I had an incident earlier on during the COVID months where somebody felt that their rights were violated, because now, we got to do tracking and tracing and also other things, and now you have to call a group of people and say, "Look, guys, this is what has happened, and all of you were around this person," and that kind of a thing. I find myself, and as an employer, and what do they call it, somebody who's senior, in a space where you look at this and go, but which one is correct? You talk about the sharing of the load, the work that has to be done, and all of that. Now, a lot of managers out there that are sitting there and going, okay, so now how do I tell these people to do the work that Samke was going to do without telling them what has happened to a great degree? So and I think, as I say, education is much more important in and around this, because I can hear somebody out there going, but if I don't declare what's going on to the people, they're going to keep on asking me, so when is she coming back? Yeah.
No, I'll be honest that there's many gray areas. Yeah. It's quite a precarious, difficult thing to navigate, and I have to say that I don't have the answers to that. I'd like to have the answers to that, to be honest, because you're correct. There's a fine line between informing people that Samke is not here, therefore you're going to actually take her load, without necessarily also making her sound incompetent and not compromising her privacy and confidentiality. It's a difficult one, because if somebody has to go on maternity leave, they were seen as expecting a child and they're going to be away, and it's sort of understood. But if Samke was here on Friday, then she's going to disappear for 21 days, and it's not an annual leave. People know it's not an annual leave. How do you draw a line? I think it's a gray area, and it's one I definitely don't have answers to, and I would love to have the answers to as well.
But I think we need to explore it some way, because it's you find a lot of managers out there, and I think in they call it in vocal mentality in itself, it's going to be an area where we find help for managers.
Yes.
Mental health 101, and being able to understand what does it mean. Then there's the other end of it, where an employee will come through and want to make it a quieter issue, injury and duty type of thing. And let's talk about that a little bit, because where does stress play in all of this? Because probably somebody out there is going, look, my company is overloading me, and therefore it's triggering my mental health issues.
With vocal mentality, I have partnered with some organizations who sometimes people think, is it an EAP? I've approached people, I've been seeing this gap.
Yes.
Like I was saying, that other people don't know what an EAP is. They don't know if their companies offer employee assistance programs. They don't know that those things exist. So a lot of the time, these things exist on paper, or according to, ticking a certain box to say, we have this service, but this service is not being utilized. So I'd approach certain organizations that, I bring psychoeducational talks, I can assist with the EAP, and people say, no, we already have an EAP provider.
Yes.
But it's to say that, how effective is that EAP provider? How effectively is it being utilized? And I would see that employees still don't understand when do they come to seek support? Who do they come to in terms of seeking support? And I think one of the biggest things is people being empowered to remove the shame, because if you're now people don't even trust the EAPs because they're thinking, this information I'll be sharing, who is it going to?
Yes.
There's that fear to say, am I going to be seen as weak? Am I going to be seen as incompetent? So it's bringing the psychoeducation to the employees before there's a crisis, to know that, to destigmatize basically seeking help and support, to know that using these services is not about having to be in a crisis, but it's to actually use them because they are there and can provide the necessary support that is necessary, assisting with finances, assisting with grief, assisting with coping with workload, because people are different. They may be in the same position, but people have different coping skills and what they can take on. And the last thing you want is for the work itself to be the cause of somebody becoming unwell. But unfortunately, the pressures, they can just add to someone's already existing stress, because I may come as Samke, but I bring all the other burdens that I carry and other challenges with me to this environment. And you want to be effective within that environment called work.
I like that we gotta see the employee and the person that you work with as a holistic person.
Yes.
And not divorce their personal lives from the stress that they enjoy at work, and then from ultimately them being in the community and how they get to be. But I can hear it out there from a manager going, but at what point in time am I being nosy? And where do I draw the line? So how do I balance the asking and finding out, how are you doing, Samke? Well, there's the genuinely asking that, and there's the
intrusive,
the intrusive one. So,
yes.
And I think to me that becomes a big issue of like, how do we balance this? Because education is important. Us as an organization, we have a very good wellness program that provides for you. We even have an app that you can just simply click, the upside down face to say, I'm not well. And a third-party service provider will call you to just check in. What's up? You've clicked it's not an SOS type thing, but it allows you to be able to say, I'm unhappy. The upside down turned mouth face to say, I'm not well. And that we had found that a lot of people are actually utilizing the system because so what we get is we get blind stats that says so many people have used it and all sorts of other things. And we've seen it when a traumatic event happens and all of that. We have been able to call up on the service provider to bring us. But having said that, I've also had a bad, what do they call it, incident where after we had lost one of our employees, they sent us a mental health professional who just was not up to scratch. They came to come and fix the team. And later on I had to, they were not allowing them to grieve. Is that something that happens regularly in the profession? Is it?
I think people don't know what to do with vulnerability.
Okay.
I think people, when people are struggling, that phase of saying something traumatic has happened, an employee has passed on, it is in keeping, it is appropriate that people have a level of trauma related to it or devastation to it. But oftentimes there's a wound, there's this gaping wound, and people quickly try and plaster it because they don't know how to process it you try to just get people back and to bounce back
Yes.
without allowing that space. And I think it happens in many environments outside of the work environment, that something of a crisis has taken place and you want to just add a bandage to it, and then it festers because it hasn't been addressed well. So I think being appropriate in how we deal with the issues, and knowing that it's appropriate that the team will be grieving. It's appropriate that people will not be as motivated because they've lost somebody. 1 minute the person was there, the next minute they were not there. So those things to be addressed in an appropriate manner is so important. And to also somehow try and individualize it instead of bring somebody who's just going to come in and heal, come with an intervention that is a one-size-fits-all. And it doesn't work that way because people deal with things differently.
Now, we've gone from where we were educating companies and all of that. And this is the most intriguing conversation I've ever had. Because to me, it's then, now how do we get to the schools and get, educators knowledgeable about at least picking up the symptoms. The Satu would kill me for burdening the teachers again with having to look out for mental illness, but just identifying the skills but identifying the skills correctly, because this can also be weaponized. Because somebody can then just from at a whim say, no, this one is not well, and they must just get out of my class.
I think it's a very important question that you're asking, because when it comes to mental health, people are usually now in hospital, and then it's in a state of the person is unwell, and that's how it's being addressed. So the work environment, I think, slowly but surely companies are now, especially with COVID-19 having happened, I think a light has been shone on mental health, mental wellness. People who have lived with mental illnesses, others have, it has worsened as a result of COVID-19, and people who don't have pre-existing conditions have found themselves living with mental health issues due to the impact. But this element of the schools is a very important one, because, I was doing recently with one of the high school, secondary schools, the things that we take for granted as knowledge, be it, organizations that provide non-profit support. People have never heard of such an organization. So what I've realized is that awareness about mental health and mental illnesses is being saturated is concentrated in certain spaces to a point where people can take it for granted. But there's spaces that don't have it. And I think we look at I think it's a three-pronged thing where it's the students that need to be empowered, it's the parents that need the support and the knowledge to, pick up issues in the home setting, then it's for the teachers. I don't think we can actually expect the teachers to do more than what they're already doing. They're already burdened, I'd say, with what is, so many expectations rest on the educators. It's unbelievable. Having a disciplined child, the teacher has to do it, whatever things are laid on the teachers. But I think my quest as well, and part of what I do with Vocal Mentality, is that trying to get psychoeducation within the school setting, but it also, there may be many issues of how it's embraced, who embraces it, how do you go about it, how do you get the buy-in. I mean, if you're only one person trying to achieve a cause, where do you start, where do you end? But it's to start somewhere. So like I'm saying, it's those three aspects. When speaking of schools, it's not just for the teachers to empower them to teach, but to also bring it at a level that can be understood by learners in whatever grade. When do you start? You started at university level, you started at high school level, because mental health issues are not just for when we are in our late 20s, 30s that problems start. These things start earlier on, and it's important to, the earlier young people are aware of mental health struggles, I think the better they are as adults in terms of knowing it, coping better with mental health challenges.
Now, we've passed the education sector and right in the beginning there, but I've seen it numerous times, and from way back then when I was at university, and that is years back. I guarantee you that. Where something happens to somebody and, there's an ambulance that gets called, and then ultimately the person is sedated and, they're taken away and most of our things. And we speak about it in, hush tones and all of that. Are we doing enough at universities to be able to make sure that not only there's an education for the individual, And believe me, today I'm getting educated personally. So there's the level of the individual, because the individual has to be able to, the self-management involved in this, but the peers themselves, then ultimately the multiple structures that are there in universities to be able to manage these things. Are we doing enough?
I don't think enough is being done. I don't think enough of a light is being shone on it. People are realizing that there's this issue of, young people are struggling. There's suicide, an increase in that. And, they've started in terms of providing the care. I just think there's an element of being overwhelmed. Who provides that care? At what stage do they provide the care? Is it when this has happened in this university, then we start the conversation? Is it when how many learners must have suffered before people see that this is a crisis? So I think really normalizing mental health education in that space as well. We've spoken about the schools in terms of maybe looking at it as high school level, but universities, it's a very difficult time for young people to, balancing. Many are away from their homes, so it's adjusting to that. And then there's the responsibility of having to attend class. It's a very pressured time. And I think, not just saying we have a counseling service and this is the number, because you may find that it's very underutilized, is to prioritize it somehow in the syllabus as young, be it for the first years or whatever it is, to actually prioritize it, make it a part of, not necessarily a curriculum, but have a time where you say, I don't know, every 2 months or every 6 months, however the time frame is, to say, we're going to have a mental health talk, and this is what mental illness looks like, maybe the common conditions, discussing suicide risks, how do you pick up your friend, your colleague, if they're suicidal, how to see it in yourself that you're now not well, those kinds of things. So it's to not just say, oh, we have a counseling service, please dial this number, or please book a session, because you may find that not enough people use it, because of the fact that, it might be overwhelmed, but also underutilized.
But that's what most universities have at the current moment. It's just a number that says there's a counseling service and that's it. And to be honest with you, the last time I ever saw that number was when I was registering the first year. The following year, you know your way around the university. You do your thing without getting involved with all the, the SRC related things.
Yes, I think we really need to be more proactive in terms of trying to solve this issue of mental health challenges. I think being proactive in terms of, the relevant stakeholders, basically. I think that's very important, because I think at times that what I said earlier, that thing of ticking a box to say we have the service, use it, or be it an EAP in the work environment, or saying we have counselors, but then to actually make people aware of this counseling service, that it is accessible to you at this point in time. And I'm very happy that, organizations like non-profit organizations are becoming really more vocal about, like the South African Depression and Anxiety Group is very active in making its presence felt and being more accessible. And I think that's a very important thing that's happening. But like I was saying earlier, that there really is a saturation of where the help, yes, definitely.
Now, you can talk about psychosis, you can talk about any other schizophrenia, and you can talk about anything else that's there, and people see it as there's a detachment to it that people have. But we tend to not talk about the general silent killer, which is depression in itself. And a lot of EAPs don't address the kind of depression that comes from you having another illness. The mental health issues that develop because somebody has another illness, and then that causes them to, not be at their best, and that, drags them into the space where now, when am I going to get better? How do I get it? Because there's multiple things, with men most of the time is, when am I going to be back at work? Will I still be able to provide? So there's all these things that build up beyond the stress itself, and that sometimes triggers. And a lot of the EAPs have not accounted for that. They don't see the interlink between different diseases and everything else. Yes.
I think that, sometimes the issue of EAPs in companies, employees aren't as I mean, I saw some statistics which I don't have, from the top of my head now, that some employees don't know of the existence of the EAP of EAP services in their companies, and in them knowing, it's underutilized. So I think there's a real disconnect at times to say there's the service the company offers it, and people say, why don't you use our services? But employees, we spoke about the topic of confidentiality. In me discussing my issue with you, where does it go? Who does it go to? Can I trust the service that is provided by, can you say Big Brother? It's provided by the company? What are they going to do with it? So there's that mistrust and also a lack of understanding of it. And I think that's one of the things I've observed in general, that, bringing the topic of mental health and mental wellness to employees and destigmatizing seeking that support is something that is helpful to study what the company has on offer, and then not just having it, on a shelf somewhere, but to actually encourage employees to make use of that.
But Samke, I want to challenge you.
Okay.
If I called a gathering today, unless I make it compulsory on mental health in the office, I will get a few people that will show up. I will almost not even probably find that, the seniors at work will be the first ones not to show up. and we gotta have this conversation, because we can't have this in a vacuum. It's the South African, thinking about mental health that we have to break through. The culture that has permeated through everything.
I think making it might just have to make it compulsory, Okay, I don't, until, not forceful, but compulsory, I think at times people need to be nudged in a certain direction in some ways, especially if they don't see the importance of something. So I would, I think what I think has been helpful is using my story when I speak in companies, to destigmatize mental illness, to say, I'm not speaking at you. I'm not speaking to say, these are the signs, these are the symptoms. But I'm also speaking from a place of experience, having lived with this. It's been very impactful to not just come academically and just bring this is depression, this is anxiety, this is bipolar, but to say, I know what it's like to live this journey. So I think using my lived experience has been something that's been well embraced by companies, because they're not just having somebody coming from an academic space, but they're having somebody who comes from an experience space. So this empowers people who are having struggles with their mental health, maybe having been diagnosed already. They found a connection with, no, this person is not just coming here to just talk something that they can't relate with. And then people who may not be aware that they're having struggles, related to their mental health, then I speak of something that they then connect with, like, oh, this is happening to me. And then people who may not have thought of it or see it in a loved one. So you need to address those things, because, that preventive care is so important. But I think you may just have to make these things compulsory at some level, but not forceful. Just highly encouraged.
I will remember that Samke said I mustn't force anybody to. I've got a question that came from one of our viewers that says, and people always think there's the self-diagnosis thing. How do I know that I'm having a mental health issue?
No, that's a very important question, actually. And with Google, with Instagram, with Facebook, I can't, there's so many social media platforms. But with that, I think people need to realize that, just like saying that, you fell on the floor, you're not going to just say, I have a fracture and I'll treat it at home. It'll be diagnosed, you'll have an x-ray. And besides having an x-ray, you will be seen by a doctor who will then tell you. Just like mental health issues, self-diagnosis is not a diagnosis. You can't say, I've lived with depression for 5 years. Then I ask you, who diagnosed you? No, I just looked at Google, I looked at Instagram. Because with other medical conditions, you're not just going to say, I have diabetes. you will have, if you're saying I've lived with diabetes, you'll have a date of diagnosis that the doctor said I have diabetes. It happened 3 years ago, it happened 4 years ago. I have hypertension. How do you know this? No, my BP was high for the first time. I had a headache.
Yeah.
When I had the headache, I then was diagnosed with hypertension 2 years ago, last month. Same with mental health issues. I can't just say I have bipolar and with mental health issues, you can end up ticking every box and thinking you have these conditions because, you know, there's a way in which psychiatrists work. There's a way in which psychologists work in terms of saying that this person has a mental illness. So it's to actually have a professional diagnosis. I highly discourage self-diagnosis because essentially it's not a diagnosis.
Now, before I get off of this, educators, you speak about a psychiatrist and a psychologist, and there's a difference. People know the difference. Then educators, what is the difference?
Okay, psychologists and psychiatrists both work as mental health care professionals.
Okay.
The psychiatrist has gone to medical school and trained in a specialty called psychiatry. You know, you can be a surgeon, anesthetist, and then you specialize in mental health. So they will be the ones who prescribe the medication and also provide some form of psychotherapy. And then with psychologists as well, they provide the psychotherapy is more intensely related. They won't be prescribing the medication because people think those specialties are interlinked, but they're definitely not interchangeable.
Yeah.
For example, I have a psychiatrist that manages me, and I have a psychologist that manages me, and one is not important than the other, and I can't substitute the one for the other. I can't just say I have a psychiatrist and say I don't need. My psychiatrist would have referred me to a psychologist, and then my psychologist would have also seen the importance of me seeing my psychiatrist, if that even...
That makes sense to me. I have a question here. I am afraid to disclose my mental health issues at work because I fear discrimination. Kindly advise.
I think it's a legitimate concern to have that fear because it's uncharted territory. You have a mental issue and you're scared of being victimized. You're scared of being judged. I think it's important to know the HR policies. I think it will be very important to see how strong how protective are those policies. Because if that HR aspect is not, and also the people you report to, are, I don't know how long they've worked there, but to see, is this a safe environment for me to disclose? I can encourage that if the environment is conducive to you disclosing, it's becomes a safety net, I think, if you tell it to people who will respect your confidentiality and be supportive of you. Because should you need admission because you've relapsed, at least people have a context of understanding what's been happening with you. But it's definitely a legitimate concern and one that, you'd have to gauge, is it a safe place to disclose and to understand the HR policies.
Now, with that, people... We also talk about the fact that they are already judging themselves first, because that is a big issue to deal with. But I want to deal with something before we go back to the issue of, liberating yourself. The issue of denial. And that's sometimes the elephant in the room, that people are actually just in denial of their own condition. Is that something that, there's a way in which we can overcome that?
Speaking for myself, a large part of the denial has come from a lack of understanding and lack of insight. As I've said, I can say it intellectually and say I was diagnosed at 14, been through many admissions to hospital, medical school was difficult because of my illness, and narrate all the admissions. But the only time I came to really, really accept my illness in the true sense of acceptance was only 16 years later. That's very recent. It's 2017. But I had been able to tell close people to say, I live with this condition. So, denial plays a very important role in one having, in one accepting the illness. And denial is because of lack of insight to whatever is happening around you. And I think what has been helpful is having a team managing me that really was patient. They found me where I was at. And they found me where I was at, and then they walked this path with me to see, where I had to understand what do I do differently to other people when I'm unwell that warrants for me to get mental health support. what causes me to behave in certain ways, what causes me to think in certain ways, why do I need this medication, instead of saying, you know what, you have this illness, why are you so reluctant and resistant to taking treatment, but to be embraced and have people understand the context that I'm coming from. That's been very helpful. So denial really is very counterproductive, because you can be given all the medication in the world. If you're still in denial about your condition, it's very hard to provide the support. To say how do you bridge that? I think psychoeducation is so important, and I think loved ones need to be patient. I'm not saying it's going to take 16 years for everybody to get over it, but I do think that having people who live this journey, like myself, speaking to people who are struggling with that journey is helpful, because you have somebody that can say they are also living with it. And that's why I say that the best storyteller is the person living with it, because that's how you connect. It's not to dismiss the importance of other people who intervene, but I have seen that, people reaching out to me in many ways to say, I'm living with this, but I'm ashamed. They're finding a lot of inspiration in hearing somebody who speaks their truth from a place of experience.
The next question says, how do you treat mental illness so that people don't feel judged? And I want to talk about it in its broader context, because creating the environment for us to be able to disclose comes hand in hand with us creating the environment where people will know that they will not be judged. And it's a very complicated question, but let's see what we can do with it.
Yes. Let's try it.
Let's try it.
Okay, I think it has to be incremental. And incremental, just, slowly but surely. I think tackling the issue, people are afraid because, there's people who still don't believe in the existence of mental illness. There's people who may say that, no, this person's an attention seeker. There's people who may overdiagnose other people and say, this one will be bipolar. This one, just labeling. Those labels are very damaging to people who may be living with a mental illness. I think taking things step by step, one perspective after the next, and you're saying that, speaking broadly, such as this platform, to, this is not Mental Health Awareness Month, it's not Mental Health Awareness Day. You've chosen to prioritize something related to mental health, mental illness, to just be part of the conversation for today. And I think having these types of conversations throughout the year, to normalize it, as much as people speak about diabetes, hypertension, lifestyle diseases, let us normalize the topic of mental health and make it part of the fabric and the fiber of everyday conversation, so that it's not restricted to certain times of the year. I think addressing this issue and removing the shame comes with educating the public, comes with us, people who are comfortable to share about their journey, to come to those people who might not understand, going to the churches, It was a full circle moment to be invited to churches, to empower and really and truly seeing the eyes light up, to say, let us not over spiritualize some issues that need to be, dealt with by professionals. So it's going to the environments that we know are rife with stigma and, having those conversations. Even with the community members, working collaboratively with the traditional, healers, to not say it's West versus East, or to say you must choose your medication, never, is to understand that we are holistic beings and different aspects of our lives need to be embraced. It's definitely not a space to say everything they said, there's no such thing as demons. I'm not entering that debate with anybody, but it's to say that let us work in a collaborative manner and go to the environments that still really hold a belief system that might be, I won't say not progressive, but is still very much not embracing in terms of allowing people to learn about this topic.
Having said that, there's still a lot of people who, end up in the streets and end up homeless because now suddenly they've started to, they had become unmanageable in the thoughts of those who, what do they call it? Somebody is asking here, how can I help those affected by mental illness?
As in like a loved one, or anybody?
Anybody. It's an individual. I mean, we can look at it in its broad sense.
I think,
from where people you work with, people you work with.
I think the biggest thing is to be empathetic and compassionate. I think, it's still a very sensitive topic that if you know somebody has a mental illness and they have not disclosed it to you, it might be very tricky if you're not maybe a family member or something they're comfortable with, to just say, hey, I know you have this condition, But I think educating ourselves, when you say, how can I support? I think educating yourself first to understand the illness, to see be it depression, be it anxiety, bipolar disorder, any mental health condition. If you want to be of support to the person, I think trying to understand the illness itself as best as you can will be helpful. If the person has disclosed to you that they are having this mental health struggle, I think it's to find them where they are at, because people are different and people might want to keep their illness to themselves. But I think, other people, we may find that they were performing well, all of a sudden the work deteriorates.
Yes.
So instead of jumping at the fact that the person is lazy, maybe try and probe deeper. And people say that it's a common saying to say we are our brothers and sisters keepers. I think having more empathy and compassion towards a person living with mental illness is very helpful. Like I'm saying, if somebody has broken a leg, you send flowers, you send a card, get well soon. If they're in a mental health facility, would you do the same? And why or why not? Why would you or why would you not? Because people still struggle to navigate, how do I navigate this thing called mental illness? Because it's made so abstract, and
yes.
it's still really a difficult thing to make normal. But I think we are getting there, or we will get there.
As we're getting there, how do I know I need a professional and I need professional help?
If you were doing a task, for example, this is just an example.
Yes.
If you're doing a task in an hour and you're finding yourself taking 3 hours to do the same task, so if there's a change of your norm, if you're deviating from your norm and you find that, your work performance has deteriorated, your social engagement, you were somebody that was outgoing or spending time with people, you find yourself more withdrawn, those kinds of changes where your social environment is observed to be different, or you can observe within yourself that you've become different to what you normally are. And if you find that you're not coping, because we're not waiting until there's really a crisis.
Yes.
It's about studying yourself and seeing, and also just, getting feedback. I think having people, I won't say accountability people, but having within your social circle, to just have people that, you trust and rely on to give you feedback on how you're doing. I think having healthy relationships is so important in that sense, because you can get feedback from those people. Hi, Bo, we were speaking every second day, you've disappeared, what has happened to you? And to, have that sense of self-awareness, and that sense of, besides self-awareness, I'm trying to find the word, mindfulness.
Yes.
To be mindful of your own, just to reflect at the end of the day, am I okay? What can I do differently? Reflect maybe once a week and say, looking at the week gone by, am I really still, there's normal stresses of life and, just struggling. But if you find that you're no longer coping as you used to, then it's a sense of saying, let me seek professional help, and not to trivialize your challenge. I think oftentimes I call it the resilience contest, who can carry the most without the help? Your problems are smaller than mine. Why are you needing help when I don't need help for my bigger challenges? I think to normalize that sense of seeking help, if you yourself are not coping with life challenges, then to validate it by seeking help, and not to just downplay it just because you may feel like your problems are smaller than the next person's problems.
I hope people don't start calling me because I disappear regularly, but I go on holiday.
Yeah.
Just now, some kids said, do you know, when somebody starts disappearing, you must just check on them.
No. Yeah.
I'll get to this one later.
Okay.
Somebody wants to understand what is the process of and you've alluded to it in this first bit of diagnosing mental illness, and then where does it all begin? And then I think you spoke to the self-management process and being able to sense yourself, but technically, if you were to deal with it, you are confronted with a patient who comes through, and how do you start the process?
So if somebody presents to me, with the challenge that has brought them there. I think maybe what also I'm gauging from the question is what causes it. I think that's what I'm also gauging.
Yes.
So before I talk about the management of it, is to say there's many causes of mental illnesses. There's many possible causes, rather.
Okay.
For example, there's a genetic factor where it can be because, for example, say both my parents are living with bipolar, the chances of me having it or having the predisposition to show symptoms of bipolar are higher than a person who might not have a history of mental illness in their family. So the genetic factor plays a large component or predisposing factor. Then you get things that may precipitate the problem, such as substance use. So you may, people have different thresholds in terms of their consumption. But other people, if you're having a mental illness, it's not a good idea to maybe add alcohol to that mix because it may precipitate those symptoms. There's things like protective factors which are supportive to people. How is your support structure looking like? So you may have certain stressors, but other people might cope differently with those things. So there's many things that may cause it. Other people may not have been born with the mental illness or don't have the genetic loading, rather. But life circumstances can put them in a position where they have it. External factors may cause that. In terms of coming with, now you're coming to the doctor, they will take your demographic information, and understand, past medical history, family history related to your illness, your information as a person, and then probe very intricately. And that's why I say that self-diagnosis is a huge no-no, because psychiatrists and psychologists they've gone to school to analyze these things and to pick up these problems in a professional manner. So to say that what is now depression versus somebody who's just having a difficult week. So there's a symptom, looking at the various illnesses, there's a duration that needs to be looked at. There's the actual symptoms, how long have they been there, the impact on your social life, your occupational life. So there's many things that get probed. Your mental states is also analyzed, your risk of, harming yourself, harming other people, reputational damage, as you read. There's many factors that come into play. So that's why I encourage the element of self-diagnosis, because, it's an intricate process. I think sometimes the first admission the first consult, rather, can take up to an hour and a half, just interviewing you and speaking to you and probing many things. It's definitely not Google and Instagram.
I've got a very long question here, but it's loaded. I'll ask it in order in stages.
Okay.
So sometimes when you're in the middle of the mental health struggle and mental illness struggle, sometimes it may seem like, bouncing back seems unthinkable. In your journey, what has been the things that have, you have been down there probably at some point in time.
Several times.
How, there's no way out. And by its nature, as I read through this leads to the question of, us talking, or the idea of talking about the suicidal thoughts that people get.
I think, you mentioned this earlier in a different way, to say that at times people may struggle to believe that, hey, well, this person lives with this challenge because I come articulate and poised and I speak like this. So it's like, no, this one has mastered the illness, And I think it's a very important question that they're posing about, how do you bounce back? I think the important thing to highlight that it's not a bounce, it's a process.
Okay.
It's a real process. And I think one of the things that has, when I look at previous or earlier episodes versus maybe in recent years, I think the biggest difference is that my insight has improved. So I better myself with each sort of setback. And I think it's to be kind to myself to say that that can happen. There's no guarantee that I might not have an episode ever again, but to be kinder to myself should that happen. I think with the difficult one, the most difficult one that caused a setback of 6 months of my life, or rather, a setback, a mental setback, should I say, a life setback. I really had to dig deep in terms of, the struggle itself. Suicidal thoughts are a reality, and I have experienced those. I have never attempted, by no means. But I think it's my sense of reaching out for help to cope better has improved over time. I think if I'm struggling, I've learned to acknowledge that I'm struggling and have no shame in that struggle, but to reach out, I reach out better. I think there's such a level of shame and stigma to say you are not coping with something because, I mean, there's ego elements, there's wanting to show that you always have things put together. But I think my help-seeking behavior has improved over the years compared to earlier on where, you know, I now find myself in hospital and it becomes this whole chaotic situation. But I find that with time, it's been more contained because I value the feedback I get, but also seeking the help and support of people I trust has been very important to me. But also just living through those emotions of feeling, you know, a sense of being defeated, hopelessness is a reality. And I think the society we live in is so hung up on, you know, I mean, siyabangena, it's Monday, we are conquering. Not everyone feels like that every day. I can guarantee you, other people may come with Monday and they feel like they're still stuck on Thursday from the week before. But I think we glamorize so much this thing of just having it all together. And I think that's what adds to that sense of shame. When people are struggling, they struggle to come forward with that struggle because according to what they see around them, it seems like people just, you know, have life figured out. And then why is my life not figured out compared to the other person? But the reality is that we're all journeying this thing called life together, and we show up as best as we can. And I can be one of the people that can honestly say that in us showing up in our best poised states, there's struggles always, you know, to contend with along the journey as well.
Sometimes people worry about this thing because if I find out, then I'll have to, you know, start living with this thing, and then, you know, then ultimately the medication and all sorts of other things, and then the disclosure part and all of that. How do we get over that hill? Because there's that bit where people just go, nah, I'd rather not know, kind of a thing. And that to me is a big worry because people think, well, now I have to live with this thing for the rest of my life.
You know, I think it's the fear of the unknown. What does it mean if I get diagnosed with depression, if I get diagnosed with any condition, what does it mean for me? Yeah. And I think, you know, psychoeducation is very important in that sense. I think teaching people about mental health issues, to teach people about mental illnesses, mental health, knowing, you know, it's like saying you suspect that you may have cancer, but you don't want to confirm it because, you know, it means that you have to deal with everything that the diagnosis comes with. But then the sooner you know, the better you can intervene. So same thing with mental health issues. If you suspect that you have one, say it gets diagnosed, then you know what steps you can take to not further compromise yourself. So I think the sooner you know, rather face it for what it is, than to shy away from it. And yeah, you're correct in saying that the issue of, you know, being diagnosed, then you have to get treatment, and how long do you have to take it for? Is it for the rest of your life? It's a very genuine concern, but I think knowing is more empowering than not knowing and suspecting this issue.
Now, you spoke about the genetic dispositions for people to end up with mental illness. And the question here is mental illness hereditary?
It can be one of it. It's one of the possible causes. It's not everybody who has a genetic exposure. So, for example, somebody who may not have had, there's no genetic exposure or predisposition rather, then there's people who, for example, substance use.
Okay.
That becomes a substance use disorder, whatever the substance use is, or alcohol or other drugs. So that person might not have been, genetically exposed to possible mental illness, but then that substance that they're taking might just lead to them now having a mental disorder for whatever, like a bipolar induced by the substance use. So there's various causes of mental illness. Hereditary is definitely one of the causes, but not the only cause of mental illness. For example, somebody who, a person may have postpartum depression. Mm-hmm. They may not have had a history of mental illness in their family, but the very circumstance of having a child may cause that. So it's various causes, if that answers the question.
I think you've led neatly into our next question where somebody says, for lack of education, people will say, what causes mental illness? You know, as if it's like it's one thing. You know, I think let's look at the broad issues that may come up, and so that people can be able to gauge themselves against those. Yeah.
I think, you know, like I'm saying, that the various causes are not only related to genetic aspects and hereditary, as the previous viewer has mentioned.
Yeah.
I mentioned those various aspects of being predisposed to it, various causes of it, substances being one of the causes. You know, I can't encompass all the causes of it here, but I think one of the things that's important to say that there are different causes. It's not just one thing. So just because you may not have mental illness in your family does not exempt you from ever having a mental issue.
Okay.
It can happen through other means, maybe caused by external factors, such as, for example, substance use. But I think the most important thing is to realize that you will not, you rather not confirm it for yourself within yourself, but to have a professional to confirm it and diagnose it appropriately.
Now, with children and with us living in the digital age, social media, you know, when they look like at Dr. Ngcobo's life and they go, oh, I want to live like that. And how much is it contributing to a lot of this challenges with, what do they call it, with mental health?
No, social media is a blessing and a curse.
Okay.
You know, I think, I mean, I'm sure, you know, there are platforms which use it responsibly and provide psychoeducation. For example, my page is solely dedicated to mental health and not my shoes and bags or whatever, you know? So it's how it's used. And I think, I say to people that we use social media, but we mustn't get to a point where social media uses us, in the sense that there's no limit to how often. Can people actually separate themselves for 2 weeks to not checking their Instagram profile or other people's Instagram profiles? And to realize that we often, and I speak about it in my book, that we often compare our worst times to other people's best times or perceived best times, because people choose what they show on social media. So the social media has really contributed in people's struggle with mental health issues, because firstly, they can't separate the fact that somebody posing with their car or taking a car to test drive, it might not be their car to begin with. They've posed with it and brought a bouquet of flowers next to it, and you may think they bought a new car. Meanwhile, they were just test driving it to make it seem as if, you know, they've just bought a car, because it's a lot of make-believe. And I think people struggle to realize that. So that ends up affecting people's mental health, because you look at your own day-to-day, and then you're seeing what is being portrayed on social media, adverts, and every other thing, and then you end up feeling inferior and less than. So it definitely has played a role in affecting people's mental health negatively. But like I say, I think we need to have our own boundaries related to its use, more because it's very intrusive. So to say, I don't know, I will look at social media once a week, or at this time I no longer, you know, use my phone for whatever, Twitter, Instagram, Facebook. I think us having the control over it is more important than it having its control, because there will always be something to look at. But I think us having the discipline to say that I will use this platform according to my terms, not according to its availability, that is important.
But okay, how am you and me, contributing to this thing? Because remember, you could have bought the car. It's your car, you know, and you ended and all of that. But we're not talking about the bits of how we get there. And everybody just assumes, like,
absolutely,
you know, you're an overnight success. And amazingly enough, you've spoken about your life and what it took for you to get here. But, you know, somebody seeing me with a brand new car, they just go, oh, okay.
Yeah.
You understand? So how much are we contributing to it? And I want to talk to professionals across the board, because that's one of the things that is just there. It's like glaringly there that people don't get told. Behind all of this, there's
a lot of hard work.
You know, there's the jumping out of airplanes.
You know, people always, I think one of the things, it's a very common saying that an overnight success takes 10 years, so to speak. And I think, 17 years. Yes, it takes, and people see the outcome and the byproduct of something, or rather the final outcome and not realize the hard work that has gone into that. And, you know, oftentimes people say, I want to be a mental health advocate. How do I do what you do? And I say, I mean, if you look at the journey itself, it's been a long and arduous, and you can't take the glamorous aspects of it and divorce it from the very difficult, dark phases of it, which continue. You know, it's an ongoing process. It's a snapshot of what people may perceive that success to be. When you say how much do we contribute, you know, we can't control how people perceive us.
Yes.
But people can control how they perceive whatever they choose to look at and see. So I think people will continue posting their new cars and legitimately earned,
Yes.
you know. They will continue showing their Rolexes. They will continue showing their shoes. That's not going to stop. But I think it's how we relate with those things that is important.
Now, with all of that, at what point in time do we get social media companies to take the responsibility for
They
it?
won't. They want us to keep using it, so that's not going to stop.
No, I know, but there's gotta be a bit. I mean, then the level and the number of suicides that are now, and it has crept out of, you talk about it as like between the 17 and 28 age group. It has crept out of that into the 14 to 12.
Yes.
Age, and you can blame the parents, you can blame everybody else, but we all have a collective responsibility to this thing.
Absolutely. No, I definitely agree with you. And I think the last time I heard that the youngest suicide, not like an accidental death, but
Yes.
an actual suicide, was of a 4-year-old. I can't remember, was it in the US or wherever, but it was of a 4-year-old. The one I know in my work, in my clinical exposure, was an attempted one, was a 7-year-old. And you ask yourself, it's getting younger and younger, what is the problem?
Yes.
And you're correct in saying that we can't blame the parent or blame the teacher, because the blame game doesn't solve the issue. I think it's to probe what is causing young people to be so distressed that taking their lives seems like an option to them, or mental health issues are becoming younger, or becoming so severe, younger and younger. And, we spoke earlier about where do we begin? Do we begin at university level? Do we take it in the work environment? And the reality is that if the age of suicide is getting younger and younger, it means the interventions then need to be earlier in order to combat these issues. Not to wait until to say that the topic of mental health or mental illness is for a certain age group. It's to tailor make it for that particular age group. So if it's in primary school, you're not obviously going to say, define it in very difficult terms, but to make it accessible and understandable at that level.
Now, one of the things when you start talking about mental illness and mental health and everything else is the need beyond the self-diagnosis to diagnose others. It's like, oh, that's what's going on there. Now, how do we manage that? Because I think it's the more and more education goes out there, the challenge with it is also comes the issue.
Dr. Google.
Yeah, the Dr. Google setup, yes.
I think to address that issue, people are becoming more aware, which is a good thing. To become more aware, because I've had it a number of times where people come and say they suspect that their colleague has a mental health issue, or they suspect that a loved one has this issue. So I think that sense of not suspicion, but the curiosity and wanting to be more proactive is a good thing. But I think there has to be a line between, that now you're diagnosing everybody with an issue. I think that can lead to its own problems on its own. And I think I go back to saying that, let's allow the professionals to be the professionals and know how to approach people and try have a level of, a sense of having a right approach to approach people that you suspect may have that struggle. Because, it's either people are self-diagnosing themselves or people are diagnosing other people, and both can be problematic because it might mean that the person is just having a difficult moment at that time. It doesn't mean that they're necessarily having a mental illness.
Now, and we will get to the point where I just let you do your advocacy work. But
no problem.
Somebody asked here, how does one bounce back and get to happiness and all sort of other things. Let's talk generally about general coping mechanisms. So beyond the medication and all that, how does the individual self-manage the coping mechanisms?
That's a very important question. Okay, when they first said, how does one bounce back and remain happy?
Yes.
The reality of life, there's no such, I'll be honest. Life does fluctuate, just by the nature of life being life.
Yeah.
There are great moments, there are difficult moments, and that's just the cycle of life. So bouncing back from that difficult place is not just about taking medication. It's very important to ask that question, because in mental wellness, professionally so, it's a multidisciplinary team. Yeah. So I mentioned the psychiatrist, psychologist, there's occupational therapists if necessary, there's social workers, but there's also that sense of being an agent of your own well-being. Because I'm not just a product of just taking medication, seeing my psychiatrist, seeing my psychologist, and that's it. There's a sense of me being more proactive about my life. So looking after myself, exercising plays a role in terms of I should be exercising more often. But, there's
we all wish.
Yeah, we all wish for that. But it's self-care. It's important for us to look after ourselves. Like you were saying, that your disappearance might not mean that you're not well, you might be on holiday. It's about us looking after ourselves and getting to a point where if you don't have a mental illness, preventing that, by looking after yourself, having a strong safety net, reaching out for help when necessary, being aware when you're not coping. And, one of the psychologists once said, it stuck with me, that we all have coping skills.
Yes.
But it's a question of what is is it a healthy coping skill or counterproductive coping skill? Because someone may say, I cope by drinking 2 bottles of wine every day. So, that's not a healthy coping skill, but that's the person's coping. When they say that they're constantly anxious at work, so when they get home, all they need is that. So these different kinds of coping skills, to have healthier coping skills that are productive and helpful. So in terms of, exercise, taking a walk, hiking, finding things which you enjoy. And what I found very helpful, even with my journey, you say that, I come across as if I've just coined this mental health thing. But I think knowing my safety nets has been important. Knowing what's protective. So, I write, I read, listen to music, finding things that I enjoy and that look after me, that uplift me. And that's been very important. I think it's a very important comment or question to say that besides, those things that people might not afford at times, what else do you do? And these things I've mentioned are things that are also protective of me, to just, reach out for help and be aware of myself, be mindful as well. Those things are equally important, should I say.
How important is it that for people to detach? And I'll tell you why I'm asking the question. So I personally I do a whole lot of things. I'm on Instagram, I'm a content creator, I'm a photographer, I do all sorts of other things that normally most people would not attach to what I do. And I find that being my outlet. So when I can feel it like, no, I think I'm slowing down. And with me, that's normally when I realize I'm not okay. It's like I'm slowing down. Like when somebody tells me something, I always have to say to them, what did you say? And once I say that, then I know that something is, I'm tired. I'm physically just not there. But how important is it for people to, not everybody can afford to go on holiday and do this and that. The issue of detaching. And let's talk about that. And I want to put it as that, as being the ability to detach, Take a few days off and...
Yeah, I think that's very important, to detach, unplug, whatever the word is. And I think it's about having boundaries with the things that we do. And for example, even in a work setting, to say, when it comes to this time of the day, I will no longer look at my laptop. Is to say, even if it means that you lock your laptop in the boot of the car because you find yourself clicking away at 9 p.m., it's to have that sense of, it's Friday, there's certain things I won't attend to related to work until Monday. And some things may seem theoretic because maybe the work environment is not enabling you.
It's not conducive to that.
Yes, it's not conducive to that. But, in times of, to have that conscious downtime, sometimes parking your car wherever you park it when, say, you get home, and just taking that 5-10 minutes to say, okay, before I get into mom mode, dad mode, let me just give myself that 10 minutes, build it up to 30 minutes, that kind of having that boundary, and to say, when it comes to a certain time, I no longer take phone calls. Not to say switch off your phone, put it away, because it's not the real world. There's emergencies that can take place. But to say, from this time, my phone is going to go on silent. I will only attend to SMSs and texts at a certain time. So it's just having boundaries for yourself that work for you. I think it's a very important thing. And to not take leave once there's a time of not coping and not being fine, but to say, I'm just going to have a mental health day. I'll take that annual leave instead of just piling up my leave days until I'm forced to take them, or to say, or convert them to finances. But to say, I'm going to take whatever, I'll take annual leave, and I'll not necessarily spend money and go on holiday and go on a spa, but to say, I'm just going to switch off from work-related things, from other things, and just attend to my well-being and do things that I enjoy and love. And I think it's to not look badly or frown upon relaxation and rest, because rest empowers us to be better in whatever we're doing.
Yes. Now, in terms of your advocacy work, the two organizations that you've now founded and now manage and work with, how can people help? How can people get involved? How can first explain them, and then let's talk about the issues that go with that.
Okay, so there's Sisters for Mental Health, which is like a non-profit. Then there's Vocal Mentality, which is my company that relates to, and people say, why is it only for ladies? And it's it's a criticism that I get, but hence Vocal Mentality, which is more inclusive. So Sisters for Mental Health is basically a platform where women come together about mental health issues. One of the biggest things where I've kept it to be maybe for ladies is because, sometimes people aren't as vulnerable when they're with other people, like other genders. So I thought I'll focus it to women, and where we can talk. I usually there's always a professional at hand. So I usually have people who share in their journey with mental health struggles and how they are coping with them. And then I'll have a professional there. So we had an event recently on the 2nd of May where we all gathered. It was about 40, 50 ladies, and we had a day session, basically, where we had various topics. So it was about seeking help and normalizing seeking help. That was the theme of the day. And people who have living with mental illnesses were sharing in that. So it's about psychoeducation, empowering people. How do you partner? Well, still growing. People are welcome to, our communication happens on our social media pages or by email, our website. And with Vocal Mentality as well, that's when I connect with the corporate community, psychoeducating about mental health, mental illness, using my personal journey and medical knowledge, which has been really incredible and well embraced in recent. It's been a tough journey, I'll be honest, to be understood in what I do. But now I feel like I found a home in the corporate sector who have been really embracing, but not only corporate, but also the community at large. So I think the common thing about both platforms or organizations is that it's about psychoeducating in a manner that is more accessible and conducive, because it's creating an environment that is safe and comfortable, so that the topic of mental illness and mental health is not intimidating for people, because it can be very intimidating. It's a very difficult topic to address, but it's to do it in environments that are more embracing and comfortable. So, for example, one of our events that we had last year with Sisters for Mental Health, we went hiking. We've done quite a number of hikes. So not everybody has to be fit, but it's just to say, we go for a hike and then there's a professional who comes and speaks to us. So last year was one of the psychiatrists who are very generous with their time, where they teach and educate. So then people, if you say on a Saturday, please come, we're having a mental health talk, I don't think the turn-up will be very high.
No.
But if you say, let's go for a hike, and then afterwards we'll have a conversation, people are more willing. So it's to create activities and have environments where people can connect and then bring that professional support, which I think is cardinal to both platforms.
But Samke, men go through a lot.
Absolutely.
And we have to find menu. We need to talk about how we sort this thing out.
I completely agree.
And probably I might be a founding member of Brothers.
Brothers for Mental Health.
Brothers for Mental Health.
I completely agree.
Men go through a lot. I must say, it is something that we have to do something about.
I completely agree with you. And I think, you know, the way Sisters for Mental Health had started would help you understand why it's Sisters for
Yes,
Mental Health.
yes.
You know, it was a WhatsApp group, and then the WhatsApp group then became an organization. So, you know, it started very informally. And then as time went on, I realized that I don't want to be seen as a doctor who only attends to women's mental health issues, because I believe that men are also struggling and they deserve that acknowledgement in their struggles. Hence, vocal mentality encompasses males and females. So I'm intending to create an environment where I have a community of males and have specialists who can speak to things that are cardinal and relevant to males, because mental health is not exclusive to women only. It actually impacts men as well. And at times, I mean, the suicide rates are higher in men. Completed suicides are higher in men than they are in women, and the attempts are more lethal with men than they are with women. So I definitely don't downplay the need for men needing support.
Yes.
I'm not only a doctor who speaks the issues of women only.
We also want to go hiking also.
Yes, we'll organize those as well. The key is conducive environments. It's true.
Okay,
it's true.
We also want to go hiking.
It's
Don't
true.
talk to us on the very formal platform, and then when you go for the partying and the hiking together, then we get left behind. So
No, I understand.
for me also, the issue then becomes, okay, so we've educated the companies, we've educated the schools, we've educated the individual.
Yes.
Overall, what is the one last thing that, you know, if you were to get on the soapbox and just, you know, give your thoughts and what do they call it? What comes up as you think of the issue of mental illness and mental health as a whole? You know?
I think we need to get beyond just the teaching.
Okay.
I mean, psychoeducation is very important. It's very important, and it needs to be spread far and wide and for a very long period, and actually continue for a long period of time beyond Mental Health Day, beyond Mental Health Awareness Week. It just needs to be an ongoing conversation so that we normalize, you know, mental illness, mental health. You know, having people telling their stories and being given that platform and empowering people who live with mental health issues, because the topic of stigma can't be downplayed. I may be comfortable talking about my journey, but not everyone who lives with mental health issues. And that's why I always say that, you know, people connect with somebody who's walked this journey and lived this journey. But beyond psychoeducating, I think, you know, implementation is important. And part of it was writing my book, where people might not want to talk about their mental health struggles. Family members might not understand this journey. But in writing my book, I think that was my aim of connecting at a level where people just have it in their own space and they read that story. So I think connecting with people who live this journey is also very important. Us just connecting as a community, because there's loved ones who don't understand what it's like living with a mental illness, but they want to be of support, as one of the people who asked the questions or viewers asked the questions. So I think beyond psychoeducation, there needs to be more, I think, involvement as well from more senior people. I don't think it needs to, I think because it's such a disease burden with, you know, other conditions, infectious diseases, or more deadlier illnesses, people take mental health for granted as if it's like mental health support is like a luxury, and it's not a luxury for a select few. This affects everybody across all socioeconomic platforms. You know, it's not just for the affluent. You know, people in poverty also struggle with mental health issues, and I think making it a priority is very important. Putting it, because it is it's the third greatest contributor to the disease burden worldwide. But I think because it's invisible, people don't take it as seriously, and it's very debilitating as well.
Samke, me and you can talk until the cows come home, and the cows are coming home. Thank you for your time. Thank you for, you know, just enriching our lives, and thank you for the book. They did say don't wear green, but you brought a green book, so I'll have to hold the book like this so that people can see it. This is the book called Reflections of a Convoluted Mind, and all that is left for me is to thank you for everything that they call it. So just putting your story out there, that's one of the most beautiful things that you've done for us. But for today, the time you've taken to be able to educate us and to be able to reflect on what it means to live with this. Beyond that, we would like to thank the publishers, I'd like to thank the team that puts this together every time, and it always goes off like a bang because of them, and they make an effort, and that is always, what do they call it, a pleasure for me to work with people. Beyond that, we'd like to thank, a company like ours that looks after the people to make sure that we're educated and we're given the information to be able to understand these things. And the CEO, our board, and everybody else who supported our journey. Thank you. From me, it's been good.